now. So, welcome to my talk. So in the last days, you got a lot of information about our measurement systems, about theoretical background, about some approaches and interpretation. And now I want to give some practical tips and tricks for you, some maybe hidden features you may not know yet, but which make your work maybe a bit easier and faster. So most of these I will show you directly live in DICAM. Just one about the repeat measurement function. I have a video prepared because I don't have any measurement system connected to my computer. So I have some features for you regarding the user organization, regarding your patient organization in the patient archive, regarding the recording, the viewing, and also the exporting of your results. So going out of this presentation and starting DICAM right now. So during the login, you already see that you can select a user, which means that you can also register multiple users. That makes sense if you work with your colleagues in a clinic, for example, and want to have another patient archive than your colleague. Also, your standard language you can define there. So you just register multiple users and select your standard patient archive where all your measurements are then saved in. Of course, you can also assign multiple patient archives, so you can also see the measurements of your colleagues, but you're saving your own measurements in your own patient archive. What makes already sense for if you are doing a study, for example, you just register a user for this study and you have all your measurements done in the study in one patient archive. Just logging in here. Just be careful to have a clear name for your user so that you can identify your right user during the login process. So just starting DICAM, and now your patient archive is loaded. I have just one patient here. So if you're using an external patient software, for example, in your clinic, and have a new patient which is coming to your clinic or to your practice and which you already registered in your external patient software, you do not need to add this patient here again manually. So you can use your, for example, HL7 interface. If you activated this interface, it's possible to send all the information of your new patient, which is already in your patient software, to DICAM. So you have all the information directly in there. So the way there it is that you have a, for example, import entry coming here. So you get a pop-up. Oh, there's a new patient coming via your HL7 interface. Yes, I want to load it in my DICAM. This is your new patient. You just click OK. And you have your patient here in your DICAM software. So you avoid typing it manually, everything. If you go to edit, you see all the information is here already in. The birth date, the height we need to add, and also additional information like the address. And then you can just start a new measurement with this patient. You can also use the HL7 interface for the way back. So if you did a measurement, all the results you can send back via the HL7 interface back to your clinic software. And you have all your results there in this software, together with every other information of this patient. So if you defined a standard print page, where I come to later when we have the export pages, you come out of a measurement, all your standard print pages are exported and saved, and also if you activated the HL7 interface, send as an HL7 file, which you can then load back to your patient software. So, how do you organize all your patients if we have a little bit more patients than I have now in my patient archive? It's possible to have comments to your patients. Doing this, you just click here in this text field and type in manually. You also have the possibility, if you always have the same comments or you do not want to type it in manually, to predefine automated comments, which are then here in your drop-down list. So you just click here in the drop-down, for example, with markers. If you already measured a patient and recognized, oh, it's better to have markers in the static photometric analysis, you just type here with markers or select it from your drop-down, and you know when this patient is coming back for a follow-up measurement, oh, this was the patient I should have markers on in the static measurement. So the same you can do for, if you select the measurement, the same you can do here for your measurement comment. You can type in here, again, manually, but if you have, for example, a reaction diagnosis with eyes open and eyes closed, you do not want to type it manually, eyes open, eyes closed. So you predefine your comments, just select eyes closed. So you can also select multiple comments, and you can edit it afterwards after setting in. So these comments are then also on your report page, so the patient directly sees under which condition this measurement was made. And also for you, it's easier to find a measurement if you put here a comment. Another possibility to sort your patient archive is the option to set as favorite and also to tag a measurement. And then you have the possibility to filter for your favorite, for example, so only the measurements you set as favorites are listed here. The same for your tagged measurements here. So these features help you just have your patient archive organized and do not need to look for the measurements for a long time. So then you want to start a new measurement. You already see I have a type favorites. So if you're doing always the same measurement sequence, for example, the modalities static photometric, static posterior leg axis, static anterior leg axis, and pedoscan. You do not want to select all the modalities manually the whole time. So it's possible to set it as a favorite. So in this case, you just click to the file favorite, select your static examination, and start your measurement. So how can you do the set up the favorites? You just select your modalities, for example, the body motion, the posterior leg axis, and the pedogate. Now at the bottom right, you have the possibility to set this as favorite. Now you see this combination of the modality is set as favorites. You go then to your tile, have this new favorite. So in this case, you can just rename it. Say, okay, this is my dynamic standard. So then you can, in your follow-up measurements, just go there in the favorites and start your measurement. So now I'm coming back to my presentation to show you the video, because we have one option to repeat a measurement. So if you want to have multiple measurements in a sequence, for example, for reaction diagnostics with some wedges or with some eyes open, eyes closed, you want to do it fast after each other, the measurements. So it's possible to enable the option to repeat the measurement. So you come out of a measurement and you are asked if you want to repeat the measurement with the same modality. If you click yes, you are then transferred to the analysis of this measurement, but then you skip going to the viewing, going back to the patient archive and start the measurement again. Instead, you are just transferred back to your hardware initialization with the same modalities and can start directly the new measurement. So I just show you in the video. So I'm coming out of this measurement here. Oh, sorry. I just wanted to show you a bit bigger. So again, you're coming out of this measurement here. And then you are asked if you want to repeat the measurement. So if you're clicking no, then it's normal like every time. You're going then to the analysis or you're going to the viewing. If you're clicking yes, which I did here. You just analyze your measurement. Click Save, click Next. Then you skip going to the viewing. Instead, you're coming back to the patient preparation, hardware initialization, and can start again the new measurement with the same modalities. Just pay attention when you have pedo included, the patient has to step off the plate because it's initialized again. Okay. Some features we have for your viewing. At this point, I want to emphasize that you just check. Yeah.
How did you activate the possibility to have a question to repeat?
It's a global option. So if you want to activate it, just ask us or the customer service and we can enable it. So you can enable, it's then permanently enabled. So you're every time asked.
Okay. It's the same with the
HL7?
HL7?
HL7 you also have to, yeah. So if you want to use some of these features I present you, just contact us afterwards or in the next days and we can enable you or help you. Okay. So in the viewing, at this time point, I want to emphasize you to check what happened, what was analyzed. So in this case of a static photometric analysis, the fixed points are detected automatically. But sometimes, as you see here in the viewing, the markers are maybe at a mathematical plausible point, but not in an anatomical. And you have some viewing options which can easily help you to check if the position was correct. So it's, for example, the curvature map and the Gaussian curvature. So in this map, all the convex areas are marked in red and all the concave areas are marked in blue. So the lumbar dimples should be in the blue areas, whereas the vertebral prominence should be in the red area. So it's easy for you using these viewing options, especially in this case the Gaussian curvature, where you also have the green areas as your saddle areas, to check if the dimple is located at the right point. So it avoids some wrong results and misinterpretations. And you have a quick way to just check if it's right. And if it's not right, you're just doing the fixed point correction in your post-analysis. So in this case, it should be located here, the dimple fixed point. So an easy way to check for correctness of your results. So we also offer the possibility to measure with shoulder markers. These are some cylindrical markers which you can just put at the acromion. They stand a little bit up so that the photometric camera, which is behind the patient, can see it. The problem, if you want to call it, in this case is that your shoulder tilt is not part of your result table. So what to do then if you want to have this parameter? You always can customize your result tables. If you want to do this, just F9. You see your viewing page. You just click to your result table. And then you have all your entries in this table listed here. So if you want to delete one parameter which you do not want to use or which does not help you in your interpretation, you can just select here empty result for the trunk length, for example, and then it's not part of the table in future. The same you can do to add some parameters. So in this case, I want to have my shoulder tilt. You can select if in degrees or millimeters. I want to have it in degrees. I save it. You then have to reload your measurement. And then you see your trunk length, which I deleted from the table, it's not part anymore, but your shoulder obliquity is part now here in decrease. So this option you have for every parameter table. Just customize it to your wishes. What you want to have in your table, what you want to show your patient. Are there any questions at this time point? If you have any questions, just ask in between or afterwards. Okay. Coming now to your different export options. So, I already mentioned your standard print pages. If you click here to the printer icon, your different print pages are loaded. First of all, for all your measured modalities, but you can also filter for modalities. So in this case, all print pages regarding your 4D average are listed, leg axis, pedo, and so on. You just can filter for your print pages. You already see that some pages have a blue frame here. These are my standard print pages. So every time I finished recording, these print pages are exported automatically. And also, if you have activated your HL7 interface, it is also saved as an HL7 file automatically, these 2 pages, or however you have set a standard. And then you can set the HL7 back to your clinic software. You can change your standard print pages by, for example, deselecting this and selecting another. If you want to save this as your standard print pages, you can save it, close, coming back to your print pages, and now these 2 are set as your standard print pages. Okay. You can then print physically via a printer, via this icon, print as PDF. You can have a preview of the selected print pages. And you can export here as PDF or as PNG. So if I click here, export PDF, it is then exported in your predefined export path, which you defined in your options. And you get the notification, okay, your PDF is exported and saved in this path. It is already also named here, the path, so you know where it is saved. Okay, if we have a dynamic measurement, just loading it here. We have the possibility to export a video here. Clicking this, the video creation is started at your current frame. If you're not at the first frame, you are asked, do you want to start at the first frame or at the current frame? When I started here, the video gets compiled. You cannot interact with the software, but you can stop it at any time. And then the video until this frame where you are currently in is exported. Also here, your path.
Maybe one addition to this. So mind that when you export to a video file, this is screen capturing. So it is wise to actually let the system run the video export while doing anything else. So else everything else will also be on video. So if you check the email from that, of course, it's probably
Yeah.
video as well.
And it takes a while, but in the end, the video is at the same speed as you have in your DICAM then. So the whole measurement runs through during the video creation. Okay.
I have questions.
Yeah.
We have a result. We can calibrating the result to another system. As you know, some of the hospitals, they have their own system. And they are using the system for the assessment, for the treatment, for the report, for the patient. There is any option to calibrate all the result from your system to the other?
To calibrate, what do you mean calibrate?
I mean to send all the information from your system to the other, or I have to only the option that you have only the printing and the doctor he can tapping on the
You have the printing, you have your statistic export, so some parameters you can export, and as I mentioned, you can export the HL7 interface. So then you have all this in your HL7 file, which you can then reload in your external software. I don't know what software exactly, if it's possible there, but...
Like the TrackCare. The system is named TrackCare.
If it's possible there to load an HL7 file there, should be possible then.
It exports usually as a PDF file. It exports, besides the HL7, it exports as a normal PDF file.
If you click here PDF export, yes, but I will show you some statistic export too. Yeah.
So it's easier to integrate in the system to files.
Yeah, the other thing is saved as an Excel sheet then,
Okay.
or you're using the HL7 interface. But then you have to see or check if the external software is it's possible there to reload in there.
So I think it's all depending on.
Okay, if you're having a dynamic pedo measurement, you have two additional export options. It's the APD and the BMP format. The APD is your pressure distribution in your midstands for left and right, and the BMP bitmap is your colored visualization of your foot pressure, and both you can use then for the production of insoles, for example. So the APD file you can just load in your 3D modeling software to just create or product your insoles then. If you are a sequence user, you have the sequence button here to send all the information needed to our partner sequence, which is then also producing or creating insoles. Okay. And you have, let's have a look here. So regarding other export options, we have our statistic export, which you can navigate here, parameter export, where you can select modalities, parameters, patients, measurements, and so on. But you also have the possibility to have like a little bit faster export of one measurement, which you have selected. Just going to the viewing again, which is the data export here. So in this case, your parameters, which you have selected in your statistic export tool, is automatically exported and saved as an Excel sheet. And this allows you to, for example, load it in an AI tool. For example, Copilot. I did it in Copilot. Just have, for example, I have a static measurement, I have a dynamic measurement containing spine, leg axis, and foot pressure information. You just have then, to specify a prompt for the AI and let the AI generate a report for you. You can also then upload a template you want to have it inside and let the AI then generate out of your results, which you exported, a report for you. Be careful, AI is not error-free. Check what it made for you, correct, and this correction can also help you and the AI tool to have then better reports in the future. And just be careful in specifying a prompt. I did that. Just here. Okay, it's now vanished. I uploaded where I uploaded a static, a dynamic measurement and our report template. And as a result, I got my report. So it's a headline with DIERS Inspire Lab. I have a report, static analysis, dynamic analysis, interpretation, and therapy options. So this could be a way for you. Yeah, sorry. Sorry?
Where did you choose to do this?
You mean the AI tool or in DICAM? So I just used Copilot, but you can use whatever you want. Just specify your prompts there. You have to learn your agent a little bit. Say, okay, your negative values are, for example, your extension. Positive values are your flexion, for example. And then it's possible to easily and fast generate a report. You can also specify in DICAM your naming of your exported file. You just can select no clear names, just export the measurement ID, for example. So then it's easier for you and you avoid that some clear patient names are inside them, the AI tool. So for the first time using this, you need to spend some time and effort on this to train your agent. But then when it's already trained, it's easy to just upload your template and your measurements and then get out of the report. Okay. We also offer a DICAM report you can also use, which has the advantage that you also have your own, not your own, the same template, but select your measurements you want to have inside. And all the selected measurements are then in this template. I can show you now. This is the tile here, report. So it's the DICAM report. You just click to generate report. And then all your measurements of this patient are loaded. It takes a while. You can select multiple measurements. Also here, your comments help you to find the right measurement you want to include in the report. For example, selecting now one dynamic measurement. If I have a dynamic measurement, you then need to specify the index frame in the next step. For example, I don't know, moving there maybe. Save selected index. So all your results are then loaded in the template. We also offer you, which you see in a while, some text fields where you then can put your own text inside. We also have a help or a feature for you to avoid typing in everything manually. So here you have some fields for patient reports, known primary diagnosis, clinical findings, which you can then manually insert. So you are not, it's not AI generated by you, but you have one template which you always can use. It's possible here, if you do not want to type it manually everything and you have your standard text to put there, to select or to specify some text modules. So I already have predefined 2 text modules. For example, the forefoot, you have your title, you have your text, which you can always edit. If I apply the section, this text of my text module is added here. You can also edit it afterwards. You can also have this new text then here. No. So you can also edit here. Save changes, and now this new text module. You can also insert a new text module. Save changes, and your new text module is here in your list. You can also select multiple. So everything you selected is here inside. If you have a text, you can save it as a text module. And save changes for your next reports, for example. Then going here, it is added. So this may help you in just saving time in creating your report, if you have a standard text, for example. So then going further, you have all your results of this selected frame inside here, leg axis. You also have here a text field with the possibility to add text modules again. You can also define anomalies. For example, this one on both sides during your mid-stance, both. It's listed here, and when you apply it, it's listed here. Also there, you can customize your table. For example, here, I put own deformity. Additional. And then in the next time, you have it here in your drop-down list. So all these features enable you to customize your report, but have always the same template for your patient then. So in the end, the last page is just to summarize. You can just put here text inside or select further therapy and so on. If you have let it empty, this page is left out then in the end. Okay, you can just click next. The report is created. And it's then just listed in your measurements of this patient as a report. You can just open it as every measurement in the viewing, and then also have the possibility to export it as PDF or print it. Just clicking here, you only have this print page, and then you can just export as PDF. So then you have different options of creating a report, and you just select whatever you want, or what fits you and your work best. Regarding the HL7 export, I just mentioned that it's automatically exported for your standard print pages. You also have the possibility, sorry, I need to select the measurement, to manually export